Hello, Gut Check Project fans and KBMD Health family. I'm your host, Eric, joined by the other host, Dr. Ken Brown. Ken, we've got a guest, and it might be painful or maybe not.
Well, if you are suffering with any type of pain, in particular, if you got back issues, you're going to want to hear this episode. We have a very special guest today. We have Dr. Arrash Kirkland in.
What's up, guys? Nice to see you. Thanks for inviting me in, man. I really appreciate it.
Absolutely.
So Dr. Arrash Kirkland is a board-certified physiatrist and fellowship-trained interventional spine and pain management physician who represents the cutting edge of modern pain medicine. He founded the Nobility Pain Management in Texas, where he focuses on treating the root causes of pain rather than merely managing symptoms.
Absolutely.
Dr. Kirkland, this is exciting because you're doing a lot of really cool stuff.
We are. We're really excited, man. I really appreciate you guys, again, having me on today. And so, kind of, if you want to little bit know about my background here. So I'm a native Texan. I grew up in Tyler, right? East Texas, went to John Tyler, and now they're calling it something else these days. Basketball player. Went to A&M for undergrad, right? And I know, Eric, you got a lot of family and friends that go out there. College Station, focused on genetics and did a minor in psychology. Then had to choose med school, so it was either stay in Texas or go to Ohio. So I ended up going to University of Cincinnati. Actually, the reason I went out there, one, because I loved the med school, but also my brother, who's he's a professional basketball player. Actually,
wow.
he played under Coach Huggins while I was in there, while I was at med school. So so during those breaks from studying, the only times I got a break, I would go and just watch him play, and then I come back. And
Is he taller?
Yeah, he's tall. He's 6'8".
Okay.
Yeah, I'm only 6'5", man. I'm short.
Only, Ken. He's only 6'5". Give the guy a break.
Yeah, so so it was nice to be out there and be close to him. So we overlapped for about 3 years, and then from med school, went out to Michigan, Rochester, New York. So for some reason, I like the cold. Maybe it's because I grew up in Texas and I wanted to experience that, but it wasn't fun. Did my PM&R residency, and I know you said your wife's a physiatrist as well. So, PM&R is really focused on function and getting people back to kind of living their optimal lives. And so that's why I chose that as my residency. Did 4 years there, and really that's kind of where I started getting interested in regenerative medicine. So basically a field of science where we use kind of your own body, your own cells to kind of heal yourself. So that's what regenerative medicine is all about, right? And we started with really about PRP. I kind of introduced that to my fellow residents. They're like, what is PRP? PRP, platelet-rich plasma therapy, which is, and I know we'll get into it a little bit more, but I just kind of introduced to them that this is something that we use, that athletes use, some, Tiger Woods, Hines Wards, some of these other professional athletes, Kobe Bryant, right? They've used these cells basically to heal themselves, right? So they can get back in without having to undergo surgery and, using steroids and stuff like that. So that's where we kind of got introduced to regenerative medicine, and then I did a fellowship at Michigan State. And there I was the first one to bring that into our fellowship. So I was the one that got trained, did the PRP, went down to Florida. At that time was with Insight. It's one of the PRP companies, and they still exist today. They're a great company. Got trained, and then brought that to our fellowship, and so they started doing PRP. And then after that, a year in fellowship, went out to Arizona for 4 years. And then my wife, actually, God bless her, she was with me through all that, and then she was, all right, we're moving to where I want to move. So we moved out to Arizona. She did law school, so my wife's a lawyer, she's an attorney. And so we were there for 4 years, and then I was like, all right, it's a little too hot out here. Let's go back to cooler Texas. And so we've been here ever since. That was about 2016. And so, we've been in the Metroplex, and that's kind of where I am today, man.
So he drives way more than you do, because that's a lot of stops.
It was.
That is a lot. Yeah. Eric makes fun of me because I'm the world's worst commuter. So my whole life is like one tiny little circle, except when we come out here in our temporary podcast.
Yeah, exactly.
Well, so you and I met because I oftentimes get to do the anesthesia for your patients that you bring into the surgery center. But by the time I've seen them, then what you've already counseled these patients. They've made a decision on what it is that they need to have done to them. What is the type of patient that, because if someone hasn't heard of PM&R on their own, you're definitely a medical doctor. Describe who ends up finding a PM&R physician and what kind of symptoms they may have to get there.
Yeah, so usually it's people that have had some kind of chronic pain issue generally, and they want to get back to being themselves, right? So they're really focused on function. All right, so, as a pain doctor, they've probably tried things like physical therapy. They've done the over-the-counter stuff like, anti-inflammatories. They've done Tylenol. They've done other kinds of modalities, and they're just not making headway, right? So they seek out our expertise, and they want to say, hey, is there something else that I can do? And really, mainly to avoid surgery. They're like, I don't want to do surgery, so there's got to be something else. And so we're kind of the in-between, between the kind of more conservative things to surgery. And so that's how they come to us. And a lot of times, actually, even in Michigan, if you're going to have like back surgery, they actually require you to see a physiatrist first.
Oh, wow.
Yeah, beforehand to make sure that it's absolutely something that they need prior. And so they'll come and see us. And so that was kind of interesting.
Sure.
When I was in Michigan, that was one of the requirements from the insurance. Like, hey, you have to go see a physiatrist before you could consider surgery.
Does it only apply in Michigan, or do you know other states that do that too?
I think, I only know about it in Michigan. It's not a requirement here in Texas, I can tell you that, because
Sure.
I know I've seen a lot of post-surgical patients as well who may or may not still have some of the same symptoms, or maybe have additional symptoms, especially if they've had fusion surgeries for their back. They'll come in and they'll say, hey, doc, yeah, I had that, that leg pain that was shooting down, and man, that surgery it went great for that. Like, I'm not having that, shooting pain down my leg anymore, but now it's my back. And it's like killing me. It's like, there's something else I can do. And I'd explain to them that, with the fusion, it does help. 80% of people, you have what we call radicular pain, that pain that goes down. You're like, it helps. But then the problem is now you have this adjacent level degeneration, from, above and below where the fusion is.
Mm-hmm.
And so that starts causing pain. And that's something else that needs to be addressed. And that's where we come in. Right. So, hey, doc, I don't want to have another fusion surgery. I mean, that rehab, all that stuff that I had to do afterwards, the time off of work. I need to do something else where I can still live my life and be functional. But that's also going to help me, with my pain. And so that's where they come and see us. Yeah.
So, go ahead.
Oh, when I went to medical school at University of Nebraska, there wasn't even a residency for PM&R. I didn't even discover it till I went to San Antonio.
That's right.
And I think there was only a few residencies around the country at that time. So 2 questions for you. How did you even really discover that, understanding that you wanted to work on basically, the healing process instead of post-surgical? But your whole comment of PRP, bringing it to the residency, I didn't even learn about PRP until we did the podcast with Wade McKenna.
Yeah.
And so how did you discover PRP so soon, and how did you even discover doing PM&R?
Yeah, so I discovered PM&R actually, it would have been my 3rd year, I believe, of medical school. I was working with one of the doctors, Dr. Watanabe, actually is a very well-known PM&R doc there at the University of Cincinnati, and he's the one that kind of got me interested in it. And he was like, hey, if you really want to do something that's about function and helping people, but you don't want to wake up at like 6 o'clock or 5 o'clock in the morning and be a surgeon, then this is probably what route you want to go. So, and I got to see, and the thing that was nice, and is nice about PM&R, there's really a lot of avenues that you can go to with PM&R, right? You can go through, stroke rehabilitation, there's spinal cord injury, there's neuro rehab, there's people that are post joint replacements, so there's a lot of different avenues that you can go in, as well as, inpatient physiatry and people that go into long-term acute care facilities. You can treat those patients as well. So that was one of the things that intrigued me about PM&R, is that there are so many different avenues that you can go into, right? And so I like to have options, right? And so I went into it, and then, wait, now tell me what that second question was again.
The whole PRP, just because you were so early on.
Yeah. So PRP, it was interesting. Again, I wasn't a big golf guy until Tiger Woods, and I was like, man, he's had a lot of back pain and, the issues with his knees. And I'm like, how's he continuing to play at such a high level, right? And then I kind of found, he's done PRP, and that's really helped him. And then Hines Ward, Super Bowl champion, right? When he got through that season was using PRP, right? So that he could go and perform at a high level, and they end up winning the Super Bowl, right? So I was like, all right, if these high level athletes can do it, it's something that we need to talk to just kind of the regular everyday man, or woman. Hey, you need to come see us, see if there's something else that we can do to help you get to being back to that level that you want to be, so you don't feel like, oh man, I just have to go and do another pain medication, or I have to do another steroid shot, or I have to do surgery. Hey, let's try to find another option, something that's healing as well, and it's gonna get you back to where you want to be.
Eric, I had a really weird question from a customer.
Okay.
They wrote me and said, I'm very concerned that Atrantil Pro could be addicting. Is there any chance that you're actually hiding nicotine or caffeine in there? Because it makes me feel so good, I'm scared that if I run out, that I'm going to be addicted.
That's a crazy statement, but I'm glad they like it so much. But no, none of that stuff's in there. All it is awesome spore biotics and polyphenols.
Atrantil Pro, not addicting, but you're going to love taking it. KBMDhealth.com. When the acronym PM and R, the orthopedist would say, well, let's get PM and R involved. And the first time I heard it, I was like, what's that? And he goes, it stands for plenty of money and relaxation.
Yeah. I don't know if
the ortho guys were jealous.
They were jealous. Yeah. And maybe like 25 years ago, maybe that would have been true. But now, no, that's definitely not the case. But that's so funny. The ortho, yeah. I used to get rubbed a little bit like that too when I was when I first started out, 15 years ago. So it's a serious field. We do good work, man. And again, it's really about getting you back to your optimal level of function.
Well, I've seen the patients that come through and have talked about their increased mobility, and they've usually come back because there's just a new area that needs to be addressed.
Yeah.
And they're coming back to you because they've gotten or received good results so far, which is amazing because nobody wants to be crippled from their back or their inability to move because it's just so painful that they can't just do day-to-day stuff. So I've seen that end result.
Yeah, appreciate that.
And but what I am kind of curious about is it seems like even within PM&R, which may not be known to everyone, but they know about it whenever they experience it. So is this a field that you would say is probably still expanding? Like what's the practitioner count right now in the U.S., do you think?
I know probably board certified, probably 2,000 maybe.
Because gastros, there's between 12 and 14,000?
Something like that.
It might even be a little bit less than that. So as far as board certified practitioners, it's probably around that amount. So it's still kind of relatively young field compared to some of these other ones. But I mean, physiatry has been around ever since probably the 1930s, like even after, I think it was World War I and beginning World War II, right? People that needed rehab after they've had, amputations and things that. Yeah. So that's where it's kind of started. And it's kind of been expanding ever since. And so there's new fellowships as well, like brain injury rehab. That wasn't really a fellowship that I could do when I was in residency. They have that now. Some functional medicine fellowships as well that are new. So it's still expanding. Absolutely.
It's interesting to me because in my field in anesthesia, there's some of us that break off and do pain work, pain doc stuff, but it's not to the extent of what you're discussing. What you're discussing is more true healing, and and most situations from pain management are exactly what it sounds like. It's just manage the pain, but it's masking. Basically, pain's not normal. If you're having pain, it's because your body is telling you that something is incorrect or wrong or out of whack.
Yeah, exactly. And so they come to see us. They're like, "Hey, dog, why am I having this pain?" So, someone comes to see us in a consultation. The first thing we're going to do is we're going to say, all right, tell me a little bit about your story. What's going on? Like, when did you start experiencing pain? Was there some traumatic accident? Or was there something else that you're like, or there's some kind of movement? Or is there something that's going on that you're like, man, that's, I'm starting to have pain. and we go from there to, all right, let's do an exam, right? Let's see how you're moving. We're going to do a full, body exam. It's something that a lot of practitioners don't do, right? They'll just focus on one thing. No, I'm going to focus kind of head to toe. Let me see if we can reproduce what's going on. Then we'll get appropriate imaging if needed, right? So MRI, CT, X-rays, whatever, ultrasound, right? To see if we can kind of pinpoint, even getting things like EMG and nerve conduction studies, which is another fellowship that you can do as a physiatrist. Neurology does that too. Now, EMG nerve conduction studies are basically studies to see if you're having pain, where the pain is coming from is a specific nerve or nerve root that's causing that pain, right? So if you ever need that, it's usually going to be either a PM&R doctor that's doing it or a neurologist that's doing it, right? So they come and see us, we go through that, and then we discuss like the different treatment options, right? So we'll talk about, something like physical therapy, which does work. Okay. I will never say that, physical therapy is not something is not needed, but it does work. Right. But then there's people that'll plateau, right? Doing physical therapy. They've done the NSAIDs, they've done the Tylenol, they've had, or they'll ask me, hey, what about doing a steroid injection? And so I kind of have some reservations with steroids in general. So, when we first started, somebody comes in, they're like, hey, I'm having an acute flare, some kind of a pain issue. How can I get this treated? All right, you've done your physical therapy, you've done this, some of the more conservative things. All right, well, let's do a steroid injection, right? Well, steroids are really potent anti-inflammatories, right? So they'll go to that area, within usually about 2 or 3 days after getting an injection. Say we do an epidural steroid injection. Somebody has neck pain going into their arm or back pain going into their legs. We do something like that. Yeah, they'll feel good, and then within about 3 months, doc, I'm back. I'm having that same issue again. All right, well, let's do another steroid injection. Insurance pays for those. All right, let's do it. Doc, 3 months later, man, I felt great. I was doing back to the same issue, right? And so it's like, how often can we do these? Well, they've done studies. They compared steroids to things like just like normal saline, right? Or things like hyaluronic, which is a fluid that we have in our joints, right? That helps lubricate and acts as like a shock absorber, especially like in our knees and stuff, right? Hyaluronic acid. And so they've done comparisons, and they found that steroids, they're good for really short-term pain relief, but the long-term consequences, joint degradation, tendon degradation. There's just a lot of things that, in addition to some of the systemic effects, right? Your higher blood sugar, Cushing's syndrome. There's a lot of different things like that. You get flushing, can't sleep, right? There's just a lot of issues around steroids that, there was even one study that said, taking one steroid shot accelerates degeneration in those joints. To where it's like, well, why are we even offering steroids anymore? It doesn't really make sense, and it's not really healing anything. And just like you had mentioned, Eric, when people come see us, and it's pain management, right? They're looking for symptom relief, and steroids is going to help those symptoms, but it's not getting to the root cause of the issue, right? Okay. And that's where regenerative medicine comes in.
Why do you think so many doctors repeatedly still use steroids? And I'll give you an example that I heard. I had a tendonitis in my foot, wanted to make sure there wasn't a fracture, went to an orthopedic doctor and got an x-ray. And he's like, well, let's just give you some steroids. And I'm like, won't that weaken the tendon? And he's like, yeah. I'm like, well, let's not do that. And he's like, okay. But why do you think some doctors still rely on that as their main modality?
I think one is your training, and two, it's something insurance pays for, to be honest with you. Right? And so it's quick. It's something you can do right there in the office. Usually it's something that you don't have to be off of any other type of medication when you take it, right? Like sometimes with PRP, there's certain anti-inflammatories you can't take. Can't have had steroids for a month prior to a PRP injection or stem cells injections, right? So I think it's just a quick and easy kind of modality that people, doctors still use. And, for something like an acute flare, I probably would do a steroid. Let's just kind of calm this acute flare down. But for more like chronic issues, it just doesn't really make any sense, to be honest with you.
It sounds like there's a mark where your practice in regenerative medicine really kind of separates what PM&R will do and what your practice will do specifically versus what other people will draw the line at, where they're going to stop. So when you're doing regenerative medicine, we're kind of moving beyond the steroid injection or even just using some type of local anesthetic to take care of some pain. So what are the different modalities? We've mentioned PRP. We mentioned stem cell.
Yeah.
Are there any others? Because I kind of want to get into how you would kind of figure out how to use these.
Yeah, so this is the exciting stuff, right? The things that people really want, the people that are really kind of taking control of their health. These are the modalities that help, and these are the people that come and kind of seek us out, right? So let's start with PRP, right? So PRP stands for platelet-rich plasma, right? So basically, platelets all throughout your blood. And so say you get a cut somewhere, right? Platelets will go to that area, they clump together, they help form clots, right? So they help with healing, right? But platelets also have a lot of activating growth factors that help with regeneration, right? The plasma that you actually take from when you're doing platelet rich plasma therapy. So basically the way that the procedure works is we do a blood draw, usually 60 to 90 to 120 cc's of blood. We spin it down. We get the platelets, right? And so the platelets are separated into what's called platelet-rich plasma. And then you also have, as part of that solution, you also have platelet-poor plasma. And actually what we found is even in the platelet-poor plasma, you have a lot of activating growth factors, one being A2M. A2M stands for alpha-2 macroglobulin, right? It's a big protein that, again, it circulates in the body, and it's in high levels in healthy joints, right? But then when you start having things like osteoarthritis or degradation of the joints, degeneration of the joints, those levels decrease. And so we can actually get that A2M from that same blood draw that we did the platelets, right? And what it does is it binds to what we call proteases, things that break down cartilage, right? So it binds to these proteases and you eliminate it. So it's like a nice foundation so that when you're doing platelet-rich plasma, right, you have a nicer foundation for it to work on. Or something like stem cell therapy, right? So I'll usually include like A2M along with my stem cell therapy to really give patients the optimal, treatment, right, for whatever's going on. So that's PRP. And a little bit about A2M. So what about stem cells, right? So
before you get into the stem cells real quick, is there any data on the success rate, or does it depend on the type of injury that you've seen, where you can look at somebody and go, hey, I think you're going to do great on PRP, or hey, you know what? I don't think PRP is going to work on you. We need to step it up.
Yeah. So I mean, there's definitely studies which show the differences between something like doing a PRP versus a steroid injection, right? Matter of fact, it was funny. I was just looking, I think it was probably yesterday. And one of the studies, it was in the Journal of Radiology, where they did a comparison between PRP versus steroids in people that had knee osteoarthritis, right? And they found that like 30% of the people got much more improvement with PRP versus they got worse actually after 3 months with steroid injections. And they did it by comparing like what their pre-injection MRIs look like post-injection. So yeah, there's definitely studies. And this was just recent, like I think it was May 27th, Journal of Radiology. And so there's definitely studies that show that PRP is superior, especially after anything after 3 months. It's just that the effect, it wanes with steroids, where it continues to build when you do things like PRP. Yeah.
There aren't any specific candidates that wouldn't fit in the PRP model, even though, and we'll get to stem cell, even though stem cell may be better for them, there's nobody who necessarily shouldn't receive PRP as a trial.
Nothing's 100%, right?
Sure.
So there are people, are there things that are contraindications? Yeah, active cancers, that'd be someone you wouldn't want to do PRP on. Infections, people that have low platelet counts. These are probably the kind of
acute things,
or chronic. It could be a chronic issue too. But those are probably the big things. But no, not anything that I would say, yeah, it would just definitely be a no, you can't, you're not a PRP candidate. They use PRP in facials. They use PRP for people for regenerating their hair. I know I have a friend that does that. That's only thing she does is like cosmetic PRP. So it's pretty interesting. It can be used for a lot of different things.
We had a very interesting podcast where we had she was a nurse practitioner or a physician assistant that ran a male enhancement clinic. Mm-hmm. And they did PRP in the penis.
Yes. Yeah, that is one of the things. Yeah.
And they went into great detail. Well, I'm just remembering the podcast because we're like, oh, we're gonna get deplatformed again.
We didn't air everything.
That's funny.
Ken, what can people possibly do for one of the hardest things to treat, SIBO?
Well, one thing you can do is try our SIBO support box. Prepackaged ingredients that help get rid of your bloating, get rid of the histamine response, clean up the small bowel, and actually help you sleep a little bit better. The SIBO support box.
Who doesn't want good sleep? Go to kbmdhealth.com today.
But yeah, no, they're definitely using it in a lot of things. I mean, you've probably heard the advertisements even on radio and things about these male enhancement. I know we're getting a little bit off topic, but places, and that's one of the things they use is PRP. Yeah, absolutely.
So the next modality you were going to talk about was stem cells. And before we get too far, I had my own experience with it before you and I even met. And totally was, my left elbow was hurting and I had a medial epicondylitis.
Okay.
Couldn't do pull-ups, had a difficult time turning anything, and basically went to someone else. And I think you know him, Dr. Wade McKenna, and I've known him for a long time, but he ended up telling me, after I'd already been told I probably need surgery to fix this, because it had been injected with steroids twice. Mm-hmm. And it didn't, and the pain went away for a little bit, but when you know it comes back, and I never really got full motion, just there wasn't pain.
Yeah.
And then he visited with me and he said, Eric, looking at your MRI, I don't think that we need to do surgery. However, let's do stem cells, and it's not going to give you instant relief like the Kenalog did, which is the steroid. However, after about a month, you're going to notice a change. And after about 6 weeks, you're going to see better range of motion. And after about 2.5 months, you should, for the most part, be out of the woods as far as the pain goes. Less than 2 months later, I'm back to doing pull-ups. I'm back to doing what I wanted to do, playing golf. There were so many things with rotating my wrist I just couldn't do. And so that all, that was resolved years ago. Hasn't ever been revisited. And then not long after that, tore my shoulder pretty bad. Tried to avoid surgery, and I guess the tear was just too bad. However, most people, from my experience, are in an immobilizer for months, or at least several weeks, at least about 5 to 6 weeks. Mm-hmm. And then they have to do physical therapy for 5, 8, 9 months. I had stem cells pushed into my shoulder whenever I had the shoulder surgery. 8 weeks to the day, I went and played golf with my sons. I was out of the immobilizer after 9 days, not 9 weeks.
Yeah.
And physical therapy, I breezed through it in about 3 months.
Yeah.
I'm a living testament to it. Ken has a very similar story on how stem cells saved basically your ability to work.
Yeah, 100%. When Eric had that done, we have a podcast where he was in the thing, and you were like 12 days out. And people that have had rotator cuff surgery, they talk about the rehab being just brutal.
Brutal.
And you always see the physical therapist trying to walk their hand, and they're like, ah. On the podcast, Eric's like, 12 days. And he's going like this.
Yeah. That's amazing.
It was great. So knowing that it's going to work like that, and knowing that I actually in the same body part, tried the steroids, saw it fail, moved into stem cells, and I'm telling you, years ago, and no problem since. Tell us about stem cells, how you get them, how you use them, and the candidates for that.
Man, and that's a wonderful story, Eric. And we have a lot of patients that I could tell you have similar stories of where they've done other interventions, injections, things like that didn't work, then they do stem cells. So where do stem cells come from? So stem cells are basically cells that can become other things in your body, right? So they become your cartilage, they become bone, tendon, fat. They become all kinds of things, right? Stem cells that we use come from your iliac crest, so your hip, right? And those are the ones that are generally destined to become cartilage, bone, tendons, things like that, right? So that's why we use those specific stem cells when we're doing stem cell procedures. It's called bone marrow aspiration. It comes from your bone marrow, right? That's where the stem cells are stored. So we get those. So basically the way the procedure works, right? You'll come in after we've done a consultation, we see that you're a good candidate for stem cell therapy, right? You'll come in, you'll lie down. We'll use someone like Eric who'll get you to sleep, make you feel comfortable, even do something like Twilight where you're awake but not aware of what's going on, right? We'll go in under X-ray or under ultrasound guidance. We'll see your posterior iliac crest, and then we'll numb up that area really well, right? After we've cleaned it, of course, we numb up that area really well, and then we'll numb up all the way down to the cortex, right? So yeah, it can be a little bit of a painful procedure, but we're numbing that bad boy, and we're waiting like about 10 minutes, right, to make sure it's nice and numb. And then we'll go in, and then we'll, using a trocar, we'll go into that cortex, and then we extract the stem cells, we extract that bone marrow from right there, right? And immediately after we get, say 5-6 cc's of the bone marrow, we'll inject it into that area right then. So there's practitioners that'll do what's called BMA or bone marrow aspirate injection. That's what we do. And there's also other ones that will use that bone marrow aspirate, and then they'll go put it into like a centrifuge and concentrate it like they do with PRPs. That's called BMAC. So there are two different ways, but again, both of them are used for the same reason, which is let's get stem cells into the area that you're having degeneration, where you're having, tendon issues like rotator cuff, especially like with people that have partial tears, labral tears. And so I've actually, speaking of experiences, I've also had experience not with stem cells specifically, but with PRP. Matter of fact, I told you I was in Arizona for 4 years when I was working at a clinic there. And they were definitely more into that cutting edge kind of regenerative medicine as well. I was this is a crazy story. So my wife and I, we went to we were going to for our honeymoon or whatever. We went to Fiji, and like the day of, like I'm like literally the day that we're supposed to go get on that flight, I'm like, all right, let me go dip my wife. So I dipped my wife. Oh, hurt my back. It was crazy. So I'm like, all right, so do we cancel the trip or do we go on it? I was like, man, God, I didn't get that insurance, but man, I really shouldn't go on this trip. I was like, but we've been looking forward to this for so long. I was like, screw it. I'll just, I'm going to power through. Shouldn't have, but I did. And so we're the airport through LA and from Phoenix to LA and then LA out to Fiji, and I'm just like grabbing my back the whole time, like this is crazy. So while I'm on my massage, while I'm in Fiji, basically the only thing that saved me was like there was this massage. She was so good, and she was the only thing that was like keeping me moving that whole time, because I was like I want to be able to do things, right? So she was doing massage, and then I got back home. I was like I got to do something about my back. Right. I told my partner, I was like, listen, I'm not going to be able to stand to do injections because it hurts so bad. He's like, all right, let's switch clinics. So he ended up doing all my injections that day. I ended up seeing his patients. And at the end of the day, I was like, man, let's just do PRP, man. I need to do something here. Right. So we did the blood draw. I got PRP. I wasn't under. So he does PRP into my back. And literally 3 days later, I'm like, man, I don't have any pain. This is 2016. And, knock on wood, I hadn't had pain in my back since 2016 up until last year. So 8 years at least with PRP. Yeah. Right. And that's not an unusual story. I mean, I've had other, patients, same thing. I had a 84-year-old lady, she's a very spry 84-year-old. She's kind of KL4. She's supposed to have surgery on her knee. Right. I mean, she's literally bone on bone. She's like, I don't want to do surgery. I'm old. I don't want to go under anesthesia. I just don't want to do it, right? She's like, there's got to be something else. And we've done this traditional things. We've done steroids. We've done, hyaluronic acid. Mm-hmm. We even did A2M for her, right? And after the A2M treatment, she's like, Doc, I feel great, right? My knee's feeling great. So then about 6 weeks after her A2M, that's when we ended up doing the bone marrow aspirate and do this thing. We called her like 2 weeks ago, and we're like, oh, so how are you feeling? She's like, this is the best thing I've ever done. Right? She's like, I wish I could just scream from the streets. Like, you need to get this done because it feels so good.
Yep.
Right? 84 years old.
Yep.
So, people ask me, well, is there a limit to how old you can be to get stem cells? No, there isn't. That's, yeah, you would expect, older stem cells, maybe they're not as efficient. Maybe they don't work as well, but they absolutely do. You get them from the crest, you do it the way that you're supposed to do it. Yeah, they work. I had another guy, he's a psychiatrist. Right. He came and saw me, hip issue. Again, same thing. We're supposed to go for a hip replacement, right? 50-year-old guy. It was like right before COVID. And he's like, Doc, I don't want to go under the knife. I was like, all right, let's try some stem cell. So we did same thing. A2M. He came in 3 weeks later. He's like, Doc, watch this. He's standing on one foot, right? And the foot that's generally hurting in that hip, and he's like, "Oh, look at this! I'm like, stop! I'm glad that you're doing that, but let's give it even more time to work for you." It is stem cell, just like your kind of your story. About 2 to 2.5 months later, he's like, I don't even feel the pain.
Yeah.
Right. Same thing. Right. So usually the stem cells, usually about 3 to 6 months. That's when people really kind of turn the corner, and that's when they really notice the difference. Right. PRPs are usually a little bit faster. Usually around like 4 to 6 weeks, people notice the difference. Right. As far as functional, as far as pain wise being decreasing, that's when they usually tell me. The first 2 weeks can be a little bit painful, right? With PRP, there are some inflammatory components, and so yes, it can cause a localized pain reaction. If they do it, like I've done people with carpal tunnel in their hip, knee. They're like, yeah, that first week, Doc, I was hurting, and you told me I can't use ice. Yeah, well, we don't want to inhibit the regeneration, and that inflammatory, that acute phase, which actually brings a lot of cells to that area to help regenerate the tissue, right? So yeah, we don't want you to take anti-inflammatory, use icing for the first couple of days or steroids, right? Let's give it the optimal environment. And so, yeah, but then after that 2 weeks, they're like, Doc, things just improved. And so now, I'm getting friends, I've done it my brother, he was a professional basketball player. So I told you guys, I was at Cincinnati, I got to watch him. During his playing career, his senior year, he actually tore his ACL. Playing against UConn, and it was crazy because he was having a great game. Scouts were there, right? He was getting ready to go to the draft. And it just sucks because then at that time they didn't really have red shirts after like you've already played half the season. Sure. So and it was a senior year too, so that's what really sucked. So then he ended up doing the whole let's do the ACL reconstruction, and then he ended up doing the rehab and all that stuff. Ended up playing for the Mavs for their D League team, and now it's called the G League, but then it was D League team. So shout out to Cuban and all those guys. And so so he was part of the D League team, and then he ended up one thing led to another. He ended up tearing his other ACL. Right, he's like, God, am I gonna get a break? So again, reconstruction, had the Rangers doc do the reconstruction for him. Did really well. So then he went overseas for like about 5 years, played over there, and then he came back home. And he's like, the reason I stopped playing is because my knees they're just killing me. He's like, is there anything you could do? And this is when I had started with my fellowship. I was like, come on in. So I had him come to Michigan. I was like, come in, we'll do some PRP for you. He was like one of a first or second person that I did it on. I was like, hey, come on in, man. Let's do this.
I'm a professional.
Yeah, but you're about ready to do it. You're like, no, you're sure you don't want to keep playing, right?
Yeah, exactly.
So I don't know how this is going to go.
We're gonna see how it works, right? So he came in, we did his knees, and he calls me like about 6 weeks later, and he's like, yeah, Arrash, man, I'm feeling a lot better, man. I can move around and I'm doing a lot better, and he's seen me periodically for things, for he had a shoulder issue. I remember he some rotator cuff, some of the tendons that were torn, not completely, but partially. And that's another thing. So people ask me, well, is there a difference between like partial and complete tears? Yeah, there is, right? So PRP works, but you have to have something there already where you can attach to, right? So like, or the stem cells, right? So for people thinking, oh, I have a complete rotator cuff tear, it's probably not going to be beneficial for you. But if it's a partial tear or tendonitis, yeah, those things, it works, right? And so my brother came in, shoulder, same thing. He was like, man, I can't lift like I used to. And then he showed me like a video about 4 weeks later, and he's like pushing it again, like 250 or something, like he was doing like he was doing it beforehand. And I was like, yeah, see, I told you it works. And he already knew because he had his knee done, but he was like, his shoulder too. I was like, yeah. So and that's what gets people excited. It's like, man, things that I might have had to have surgery before. Now I can do something like stem cell therapy. Now I can do something like PRP.
Mm-hmm.
Now I can do something else that is not only going to get my pain under control, get me functional, but it actually is healing me, right? Even with somebody who has, say, fusion surgery, right? So they have back pain and ridiculous complaints. They get the fusion surgery. Well, you still, and even they do a discectomy, you still may have a disc issue, right? You still may have, that herniated disc, which is that basically, and this is something I want to get into as well. When you have a disc problem, right? So you have 2 layers in these, we call intervertebral discs.
Okay.
Right?
You're talking about in the back.
In your back, right? In your, throughout your spine. And so you have this inner jelly-like material, right? The nucleus pulposus. Then you have this rim, this gelatinous rim outside that's called the annulus fibrosus, right? And so what happens is you get these tears in the annulus, right? And so when you get these tears, and this is when you have like things like trauma, degenerative disc disease, herniated disc bulge, right? There's some kind of generally a tear in the disc, right? So then you get that jelly-like material starts seeping out, and then the body's like, well, it's almost like a foreign substance. We don't like this. And then you start, you have reactions to that, inflammation, right? In the outer rim of the disc, there's a lot of nerve fibers too. So that kind of foreign substance to the disc, even though it's inside in the outer rim, it irritates it. And so you get pain. And it irritates it because there's nerves there, and you get pain, and you're like, I'm having back pain, especially when I'm, kind of seated forward and I'm pushing back on that disc. So you're kind of pushing it back, and it's hitting into the spinal canal. It's hitting into the nerves that run throughout the spine that actually eventually go out into your extremities. People, that's when they get pain that shoots down the arm or pain that shoots down their legs, right? It's called radicular pain. But it all starts with that disc, and that disc that's been torn, right? So, generally, even though you do fusion surgeries, you open up the areas around those nerves, you still haven't treated the issue, which is that disc, right? And so one of the things that we do, and it's really, really exciting, there is a procedure it's called DiscSeal, right? And so with DiscSeal, basically what it is a procedure where you come in, you'll tell us, yeah, doc, I've done all these different things. I've done steroid injections. I've done facet injections. I've done rhizotomies. There's a lot of different things. And as a pain doctor, I do all these injections, and I do all these therapies, procedures. Sometimes they don't work. Or if they do, they're temporary, We haven't gotten to the root cause of the issue, right? So we get the MRI. Well, MRI shows that you have a couple of bulging discs, but it doesn't really show the tear. So how do you know you have a tear? Well, then you come and see us. We do a consultation. You're like, yeah, I think it's coming from your back. I think it's coming from your disc. So let's get you in. We'll do what's called an annulogram, right? So an annulogram is basically a dye study. So we put like some dye, Omnipaque dye into the disc. This is when you're lying down under X-ray guidance. We can put this dye into the disc, right? We can see exactly where we're going. And then it shows exactly where those tears are. Okay. And so at that exact time, we'll test like 3 or 4 discs, because we found that on average about 3.7, 3.8 discs are torn, and somebody comes in with back pain.
On average?
On
Wow.
average, yeah.
Huh.
And so we'll usually do from basically L1 all the way to S1, L1, 2, 2, 3, 3, 4, 4, 5, 5, 1 disc, right? We'll check them all at the same time. All right, so we'll see where the tears are. And then once we find those tears, then we switch out the syringe, and we have a syringe that's using fibrin. So what is fibrin? Fibrin is a protein that you naturally have in your body. Again, it circulates in blood. Again, that helps you when you have cuts to heal. So basically, it's the scaffolding for blood clots, right? And so we've also found that fibrin is an FDA-approved biologic, right? Especially, say, someone comes in with trauma, right? They have a spleen laceration or something like that. They'll spray that fibrin on there, to heal it, to seal it, right? Well, we use that same fibrin to help seal those tears, right? And so right after we do the annulogram and we see where those tears are, we'll put the fibrin right into those at that exact same time, right after. And it integrates immediately with the disc, right? And so it's really cool because not only is it integrating with the disc, but it also helps regenerate that tissue as well. It regenerates the disc tissue. One of the things that's exciting about fibrin as well is that what we found is that people, and they've done studies about this too, like compared to their native disc, is actually stronger once they incorporate the fibrin into it. Right. And we've also had a couple of people like, yeah, I've gained like half an inch, height, because you have degenerative disc disease and you start getting,
holds the fluid.
Wait a minute. Were you like 5'10" your whole life?
Yeah. I put fibrin everywhere. That's all I've been doing every day is fibrin. But yeah, so it's really cool procedure. It's been around for like the last 10 years. But there's probably worldwide 60 practitioners that do this.
Really?
Yeah.
Only 60?
Yeah, 60, 65 practitioners worldwide that do this. Yeah.
What's the downside of doing it?
So there's, I can only speak from my experiences with, the patients that have done it. All of them have done well.
Sure.
Now, is there a risk of infection? There's a risk of infection with anything, even getting a flu shot, right? One of the things that's unique about fibrin is it's also antimicrobial. So unlike even like something like PRP, which they can do into disc, stem cells, which you can do into the disc, right? There's still a small, it's maybe 2-3% chance that there's a infection that can happen with those. You don't get that with fibrin. Right. And so
just to clarify though, I agree with you. You can get an infection from having an IV place.
Oh, yeah.
So that's negligible.
Yeah. So, but as far as like the downside, yes, it's not really so much downside. It's that there is a certain protocol, and they will give you that protocol that you kind of have to follow afterwards, as far as things that we don't want you to do to irritate the disc or kind of mess up what we've already done to try to help bring that disc back to its kind of natural morphology, natural function. One of the things we don't want you to do is bending, and we don't want you to do any of these types of maneuvers, right? Shearing force and that kind of flexion force that'll disrupt what we just did.
Okay.
Right. So we don't want you to do that. But like I said, we'll give you those protocols. Things that you can, what you can do safely. And usually it's like, let's go every day, let's do like maybe 10% of what you were doing before. And then you just add the 10% to about 2 months or so, you'll get back to it. And usually most patients around 3 to 6 month time frame with this, with the disc procedure, this DiscSeal, they'll come back and they'll say, yeah, I'm feeling a lot better. Matter of fact, I had a woman. We did in November. She came back about 6 weeks. She's like, "Dog, I feel so great in my back. Now I want to get my neck done."
Sure.
Right? That's kind of what we're working on with her next. And so, yeah, as far as downsides, that's really the only thing is that, again, and that's really to help protect what we've done, not so much that anything really.
Yeah, I saw on your website you have that video that explains this really well.
Yeah. So go to nobilitypain.com, and then in Nobility Pain Management, you can absolutely see the DiscSeal kind of from beginning to how we do the injection and everything. It's really, 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 really cool.
So now we kind of moved beyond where people, other practitioners kind of stop with only treating pain, and then moving into true regenerative medicine, because we talked about the power now of PRP, stem cell, and now DiscSeal specifically with fibrin.
Mm-hmm.
You did talk about that there are things that a patient should more or less kind of adhere to, like a post-procedure protocol. Maybe even have some things that they need to do before they come, like avoid the ice and then watch out for the shearing motion or the bending over motion, et cetera. But what about addressing diet and nutrition for people who are still looking to recover? Because at least from Ken's practice, there's lots of folks who want to come in and they want to have their IBD treated or their Crohn's, but they want the medicine. They don't necessarily always buy into the idea that they also have some self-control components that could help them in their healing journey to do that. Where do you stand with their nutrition?
I agree. Like I'm not a nutritionist, but I absolutely agree that you definitely need to watch kind of what you're eating. There's definitely things like even some of the new things like peptides. There's other things that can help with furthering regeneration. Something that I will definitely I'm looking more into myself. I haven't really incorporated that, but it's definitely something that I think is worthwhile. You definitely need to look into your nutrition. And really, it's just your health is wealth, right? Let's start by, let's see if there's ways that we can prevent, some of these long-term issues, long-term pain issues. And if we can't, then there are regenerative options to help you so that you're not worsening the issue, right? And so that's really the key here, right? And one of the things that I want to also bring up was the LifeGenix Institute, right? You probably heard about that on the radio. The LifeGenix Institute is basically a preventative and wellness center, right? And so a couple of things that, they do at the LifeGenix Institute. One is we do whole body MRI and whole body scans, even whole body CTs. We do calcium scores to see kind of what your risks are for like heart attacks and things like that, right? And it's more about prevention, right? If you can catch it early, then it's much more preventable, treatable versus catching it later. Or, one of the first signs of heart disease is a heart attack.
Yeah,
it's ridiculous,
yeah.
And it's too late at that point, right? Let's try to treat, just try to catch these things early and treat it. And I think that's one of the things that at LifeGenix that we really focus on is like the preventative aspect, right? And so if we can do that in addition to the nutrition, I think those are the things that are going to keep people healthy and keep them from hopefully having to have surgeries or other kind of major altering things that they have to do.
It just seems like, honestly, Ken, with you've become, you and a few other GI, there's not really that many, but have become more embracing of the functional medicine side of how people are doing things. And by the way you've described your practice specifically, but even the other stem cell docs that we know, stem cell and PM&R activity to me is really just as much a part of functional medicine and this movement to get people to not just have drugs for treatment, but to actually have interventions that allow your body to use these tools to heal itself. Because that's really what you're talking about with regeneration.
That's absolutely. And it's funny, one of the things that you mentioned is going back to the nutrition component, and I should have brought this up earlier. I have a friend that's out in Arizona, Dr. Shad, who was recently visited by, our Secretary of Health, Robert Kennedy, right? And one of the things that they went around and showed was like the Native kind of American population and the things that they're doing as far as nutrition, things that they're eating, and how they were a lot healthier than, all the stuff that we're eating, all these processed foods that we get from, the store and trying to push more into, hey, let's do more kind of the natural diets instead of all these processed foods. And they're healthier, right? They're living longer. They feel better. So I absolutely agree with that in nutrition. That is one of the things that, that I remember talking to Shad, or at least seeing his podcast, and then seeing that, Secretary, Kennedy, really trying to push is getting America healthy again. So that's really, really, really cool. And I think he's also one that really wants to push more to, let's do more of the preventative things versus, all right, well, now that you've had this, now we got to go do another pill or another surgery, another this and that. He really is pushing more into that preventative. So I appreciate that.
Yeah, and I think it's great. I think that a lot of people probably would have more motivation if they could get that pain to go away.
Yeah.
Because that pain is exhausting. It's depressing.
It is.
If you've ever had nerve pain or anything, and there's so many patients that I see, I'll just be looking through their list. I'm like, oh, why are you on this gabapentin? Why are you on this? They're like, oh, I got an L4, L5. That's all they say. I'm like, okay.
Yeah.
And then I just kind of go, okay. And then you've had 2 fusions already?
Yeah.
Because that first one, disc above, disc below.
Yep.
Yeah.
Yeah, and then it's just like it's cyclical. All right, fusion, I feel bad. Oh, no, it's bad. Now I got to do another fusion. Now I got to do another surgery. Now I got to add another medication that's likely not going to help. And there's interactions every time you add another medication, right? So it's just let's get back to, let's start healing ourselves so that we can get back to being the best, version of ourselves.
Well, anytime you introduce hardware, I mean, it literally is a foreign body. Doesn't matter how clean it is, but it's a foreign body, and your body has to deal with it.
Yeah.
So hopefully it doesn't turn into some type of chronic issue, but it might. And especially if it's in the back, it seems like your first back surgery is just the first of 7. Seems like.
Yeah.
Uh-oh, here goes Ken.
Well, because this is the only reason why I
pulled a string. Let it go.
No. I just got back from Puerto Rico last week.
Nice.
And I have a non-painful umbilical hernia that I've had for 20 years. It's just slightly getting a little bit bigger. And every time I think that the only time I like really pay attention to it is when my shirt's off and I see myself in a picture. I'm like, damn, I got to fix that thing. But then you brought that up. One of the reasons why I haven't is because I don't want the mesh and all the other things. Yeah, I'm just going to come in. You're just going to shoot me with some fibrin. Yeah, that's it. You're going to do stem cells and then just close that hole with a bunch of fibrin.
Hey, if it makes sense, we're going to do it, brother. We'll do it.
How can people find you? And we're going to put everything in the show notes, by the way.
Yeah, so you can find me multiple ways. Nobility Pain Management. It's called Nobility, Nobility, pain.com. So come visit us. We also have, we're actually in Anna. I also have an office in McKinney. Phone number is 972-432-7231. You can come visit us there. You also can find us at LifeGenix. I think they have a phone number on there too. On the back here, again, it's located just south of the Bush, George Bush on the tollway. Clinics 17230 Dallas Parkway, and then again that number 972-236-3333. Come visit us. I do have something else I wanted to announce.
Go for it. Yeah. Go for it.
So if you come visit us, especially at LifeGenix, in the next 30 days, we'll give you $200 off any full body scan, and 10% off any of these regenerative treatments that we talked about today. So come visit us. Take care of yourself.
This is the first money mention of actually a real discount since we had the people on from Unrefined Bakery.
Oh yeah,
this is the most special gift that we've ever got to share with anybody. So $200 off a full body scan and 10% off of any
regenerative treatment. You come in, we'll give you 10% off. 30 days, man. Come in.
30 days.
If you've got pain, why live with it? You simply don't have to anymore. Arrash, Dr. Kirkland, thank you so much for coming in.
Man, this has been fun, man. First time, man. I feel great.
Well, I have one last little thing. I know that we're trying to wrap up here, but since stem cells have sort of become something exciting people talk about, I am shocked at how many doctors, including chiropractors, are advertising stem cells. I've had friends that have been offered sales jobs. I just want to comment on that because if somebody's listening and they're like, "Oh yeah, they give me stem cells."
Good question.
It differentiates from what you're doing. Can we just touch on that real quick?
Yeah. So stem cells in a bottle aren't stem cells. We're talking about stem cells from your body, right? That we get from your pelvis, that we get from your iliac crest, where we get from. You can do abdominal. It's called microfragmented adipose tissue, or MFAT stem cells as well. Those are really the only two sources of stem cells that are legit. Anything else, you have no idea what you're getting. People go down to, I have friends who say they've gone on Dominican, other places, they get stem cells, and I'm like, how do you know what they actually gave you? Well, I don't. I just trust in them. You're spending thousands of dollars for that. So let's not do that. Let's do something that we're getting your stem cells from yourself. And let's get it from someone who's been trained to do this, right? So not only an interventional spine doctor, but I'm also part of the Interventional Orthobiologics Foundation, right? So we do additional training in stem cells, in treatments, in PRP. So I have additional training that, not taking anything away from chiropractors or any of the other fields, but they just don't have that training, right? So get it done by someone who knows what they're doing.
That's a great question.
Perfect. Well, that was awesome. We covered a lot. Bottom line is take advantage of this special discount.
Yes, so come on in, guys.
Give him a call. So Dr. Kirkland, thank you so much for coming on. This was fun.